Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Questions 25. You hear a doctor talking to a nurse about a patient's discharge plan. Now read the question.
The patient in room 5 is stable and ready for discharge tomorrow.
Should I prepare the discharge papers and provide instructions on post-discharge care?
Yes, ensure they understand the medication schedule and follow-up appointments.
I'll take care of it right away.
Questions 26. You hear a pharmacist advising a doctor on medication for a patient. Now read the question.
The patient's current medication may cause adverse reactions when combined with their new prescription.
What do you suggest we do?
I recommend switching to an alternative drug that has fewer interaction risks.
Let's make that change.
Questions 27. You hear a dietitian consulting with a nurse about a patient's nutrition plan. Now read the question.
The patient's protein intake needs to be increased to support their recovery.
Should I add more protein-rich foods to their meals?
Yes, and also consider a protein supplement if their appetite is low.
I'll update their meal plan accordingly.
Questions 28. You hear a senior nurse instructing a junior nurse on wound care. Now read the question.
The patient's wound needs to be dressed daily to prevent infection.
Should I use the same dressing type each time?
Yes, but monitor for any signs of infection and report immediately.
I'll make sure to do that.
Questions 29. You hear a doctor briefing a medical student on a patient's condition. Now read the question.
The patient has shown significant improvement with the new treatment regimen.
Should we continue with the current plan?
Yes, but we'll need to reassess in a week to ensure continued progress.
I'll note that in the patient's chart.
Questions 30. You hear a nurse discussing a patient's medication schedule with a doctor. Now read the question.
The patient is having trouble remembering to take their evening medication.
Could we adjust the schedule to make it easier for them?
I think moving the evening dose to an earlier time might help.
That sounds reasonable. Let's go with that.
That is the end of Part B.
AVN Pharma Education.